the emergence and re-emergence of infectious diseases, particularly zoonotic diseases, is getting worse and worse. And that's why we see now currently on a pandemic situation.
Well, there were a number of factors that were sort of predictive of problems in the future. Everything from the fact that the world population was growing, global transport of people, global transport of animals, and that allows for the transmission of disease from one continent to another.
So a lot of people approach infectious disease issues from a singular discipline, a singular lens. They're specialized in virology, microbiology, which is great. We need specialists, but we also need big picture thinkers, people who are able to zoom out and look at problems from that perspective of, okay, we have this emerging virus, why?
But also, the fact that there's this really intricate, almost inextricable link between animal health, human health, environmental health, and now we talk about plant health.
Organizations are structured in a siloed way, including universities, by a college, discipline, department. However, the problem, the world we are facing in the world necessitates this multidisciplinary or transdisciplinary approach. This problem is not just a tropical or African problem. It's a global problem. We live in interconnected world.
And what we did is we brought people together to formalize it, to add some structure to this. And it was a small subset at the beginning who saw the value of this.
And so that's really what One Health is looking at, is there's these other factors underneath the surface that we have to really explore in much broader perspectives if we're ever going to really look at the reason why these problems happen and looking for creative solutions.
After getting to know Ohio State, one of the most comprehensive and largest university in the US and globally, we can't tap in anyone. We have the expertise here. We have the capability here. So transferring knowledge, transferring capability is very easy when you work with Ohio State.
First reason why I moved to Ohio State and that attracted me is the comprehensive nature of our university.
Often when I travel, I feel like I'm an ambassador for OSU, but I also think that being a university, going abroad, that it really gives you the advantage of being able to connect with other members in other universities or even health ministries. So I feel that it really does help to be part of OSU.
And right now we have 13 of those 15 colleges with active members of faculty contributing to the One Health program. So that's really the richness of it. It's the collaboration, the interdisciplinary nature, and the diversity of ideas and perspectives.
The critical moment for our establishing really the Global One Health initiative was around 2009, when 4 colleges, faculty members representing 4 different colleges got together, and we laid out, a preliminary plan to say that let's build this interconnected multidisciplinary program. Let's focus it on capacity building.
When you catalyze activities and then implement ways to enhance integration, multidiscipline work, whether you frame it in the One Health approach, which is obviously what we embrace, but other approaches, the return on that investment, the return on the mission tends to be much higher. Helping the populations that we're trying to address from a prevention and mitigation standpoint. Simultaneously, we bring back knowledge and skill sets where we're educating and training the future generation of practitioners and incorporating One Health in many of our curricula.
Global One Health initiative, when it brings capacity building at the center, it doesn't believe in building capability of individuals alone. It has to be with institutions, and when we also consider individuals, we don't only build one individual's capacity. We bring together a team of individuals to support. We had a wonderful example, impactful example working in Ethiopia. So we build capacity there. We provide training there. We make sure that institutional capacity is built there.
So we've literally educated and trained thousands of future practitioners and existing practitioners via our Global One Health Summer Institute.
I would like to see really One Health, being in the mainstream focus, attention by our federal government as a global agenda by the United Nations. Nations embracing it, while I recognize like the departments of health and agriculture, others, but creating a concrete platform. I think the One Health issue is not just for scientists and policymakers. It's really everybody's day-to-day issue. We're a long way to go, but we do have concrete ways of measuring our impact.